Question 1. A nurse is assessing a newborn immediately after birth. Which finding requires immediate intervention? A. Heart rate 140 bpm. B. Respiratory rate 52 per minute. C. Central cyanosis. D. Temperature 36.7 degrees Celsius. Correct answer, C. Central cyanosis. Question 2. A newborn weighs 3.2 kilograms at birth. What is the normal expected weight loss during the first few days of life? A. 2%. B. 5% to 10%. C. 12% to 15%. D. 20%. Correct answer, B. 5% to 10%. Question 3. Which is the normal respiratory rate for a newborn? A. 10 to 20 breaths/min. B. 20 to 30 breaths/min. C. 30 to 60 breaths/min. D. 60 to 100 breaths/min. Correct answer, C. 30 to 60 breaths/min. Question 4. A nurse is caring for a newborn. Which reflex indicates normal neurological function? A. Babinski reflex. B. Hypotonic reflex. C. Absent Moro reflex. D. Weak suck reflex. Correct answer, A. Babinski reflex. Question 5. A newborn has acrocyanosis. What should the nurse do? A. Notify the provider immediately. B. Administer oxygen. C. Document as normal finding. D. Initiate CPR. Correct answer, C. Document as normal finding. Question 6. A nurse is assessing a newborn's temperature. Which is the best method to check a newborn's temperature? A. Oral. B. Rectal. C. Axillary. D. Tympanic. Correct answer, C. Axillary. Question 7. Which finding in a newborn indicates respiratory distress? A. Periodic breathing. B. Nasal flaring. C. Sneezing. D. Hiccups. Correct answer, B. Nasal flaring. Question 8. A newborn should receive which medication within 1 hour after birth? A. Vitamin C. B. Vitamin K. C. Iron. D. Calcium. Correct answer, B. Vitamin K. Question 9. A nurse is assessing a newborn's heart rate. What is the normal newborn heart rate? A. 60 to 100 bpm. B. 80 to 120 bpm. C. 110 to 160 bpm. D. 160 to 200 bpm. Correct answer, C. 110 to 160 bpm. Question 10. Which newborn finding is normal? A. Blue lips. B. Grunting. C. Mild tremors when crying. D. Chest retractions. Correct answer, C. Mild tremors when crying. Question 11. A newborn passes meconium. What does this indicate? A. Normal bowel function. B. Infection. C. Intestinal blockage. D. Dehydration. Correct answer, A. Normal bowel function. Question 12. A nurse is assessing the APGAR score at 1 minute. Which is included? A. Blood pressure. B. Heart rate. C. Head circumference. D. Blood sugar. Correct answer, B. Heart rate. Question 13. Which is the priority action immediately after birth? A. Weigh newborn. B. Dry newborn. C. Give bath. D. Measure length. Correct answer, B. Dry newborn. Question 14. A newborn with neonatal jaundice should be monitored for A. Fever. B. Yellow skin. C. Cyanosis. D. Pallor. Correct answer, B. Yellow skin. Question 15. Which reflex disappears around 4 months? A. Moro reflex. B. Babinski reflex. C. Rooting reflex. D. Tonic neck reflex. Correct answer, A. Moro reflex. Question 16. Which is the normal temperature for a newborn? A. 34 to 35 degrees Celsius. B. 35 to 36 degrees Celsius. C. 36.5 to 37.5 degrees Celsius. D. 38 to 39 degrees Celsius. Correct answer, C. 36.5 to 37.5 degrees Celsius. Question 17. A newborn has a bulging fontanelle. What should the nurse suspect? A. Dehydration. B. Increased intracranial pressure. C. Normal finding. D. Hypoglycemia. Correct answer, B. Increased intracranial pressure. Question 18. Which is the priority for newborn thermoregulation? A. Bath immediately. B. Skin-to-skin contact. C. Remove blankets. D. Exposed to air. Correct answer, B. Skin-to-skin contact. Question 19. A newborn blood glucose level is low. What is the first action? A. Give 4 fluids. B. Feed newborn. C. Notify provider. D. Start oxygen. Correct answer, B. Feed newborn. Question 20. Which finding indicates hypothermia in a newborn? A. Warm skin. B. Bradycardia. C. Pink lips. D. Active movement. Correct answer, B. Bradycardia. Question 21. A newborn should void within how many hours after birth? A. 2 hours. B. 6 hours. C. 24 hours. D. 48 hours. Correct answer, C. 24 hours. Question 22. Which finding in a newborn is abnormal? A. Heart rate 130 bpm. B. Respiratory rate 40 per minute. C. Grunting. D. Temperature 36.8 degrees Celsius. Correct answer, C. Grunting. Question 23. Which reflex helps a newborn find the nipple? A. Moro reflex. B. Rooting reflex. C. Babinski reflex. D. Grasp reflex. Correct answer, B. Rooting reflex. Question 24. A newborn's chest circumference is normally A. Larger than head. B. Equal to head. C. 2 to 3 centimeters smaller than head. D. 5 centimeters larger than head. Correct answer, C. 2 to 3 centimeters smaller than head. Question 25. A nurse notes retractions in a newborn. What should the nurse do? A. Document as normal. B. Monitor later. C. Assess for respiratory distress. D. Feed newborn. Correct answer, C. Assess for respiratory distress. Question 26. Which is the priority during newborn assessment? A. Length. B. Airway. C. Weight. D. Head circumference. Correct answer, B. Airway. Question 27. Which is the normal newborn blood glucose? A. 10 to 20 mg/dl. B. 20 to 30 mg/dl. C. 40 to 60 mg/dl. D. 80 to 100 mg/dl. Correct answer, C. 40 to 60 mg/dl. Question 28. A newborn has hypoglycemia. Which sign is expected? A. Jitteriness. B. Fever. C. Cyanosis. D. Hypertension. Correct answer, A. Jitteriness. Question 29. A newborn should receive eye prophylaxis to prevent A. Blindness. B. Infection. C. Hemorrhage. D. Dehydration. Correct answer, B. Infection. Question 30. Which is the normal head circumference of a newborn? A. 20 to 25 centimeters. B. 25 to 30 centimeters. C. 33 to 35 centimeters. D. 40 to 45 centimeters. Correct answer, C. 33 to 35 centimeters. Question 31. Which finding is normal in a newborn? A. Nasal flaring. B. Acrocyanosis. C. Grunting. D. Chest retractions. Correct answer, B. Acrocyanosis. Question 32. A nurse observes neonatal jaundice. When does physiological jaundice usually appear? A. At birth. B. Within 24 hours. C. After 24 hours. D. After 7 days. Correct answer C. After 24 hours. Question 33. Which is the priority for preventing newborn heat loss? A. Weigh immediately. B. Dry newborn. C. Bath immediately. D. Measure length. Correct answer, B. Dry newborn. Question 34. A newborn's fontanelle should normally be A. Bulging. B. Sunken. C. Flat and soft. D. Hard. Correct answer, C. Flat and soft. Question 35. Which finding indicates infection in a newborn? A. Lethargy. B. Active crying. C. Pink skin. D. Good feeding. Correct answer, A. Lethargy. Question 36. A newborn's umbilical cord should be cleaned with A. Alcohol. B. Water only. C. Oil. D. Powder. Correct answer, A. Alcohol. Question 37. Which is the normal length of a newborn? A. 30 to 35 centimeters. B. 40 to 45 centimeters. C. 45 to 55 centimeters. D. 60 to 65 centimeters. Correct answer, C. 45 to 55 centimeters. Question 38. Which reflex makes a newborn grasp a finger? A. Moro reflex. B. Grasp reflex. C. Rooting reflex. D. Babinski reflex. Correct answer, B. Grasp reflex. Question 39. A newborn's skin peeling is A. Abnormal. B. Infection. C. Normal finding. D. Allergy. Correct answer, C. Normal finding. Question 40. Which is the best feeding method for newborns? A. Water. B. Breastfeeding. C. Juice. D. Formula only. Correct answer, B. Breastfeeding. Question 41. A newborn has nasal flaring. What does this indicate? A. Normal finding. B. Respiratory distress. C. Hunger. D. Sleepiness. Correct answer, B. Respiratory distress. Question 42. A newborn should receive vitamin K to prevent A. Infection. B. Bleeding. C. Fever. D. Jaundice. Correct answer, B. Bleeding. Question 43. A newborn with sunken fontanelle may indicate A. Overhydration. B. Dehydration. C. Infection. D. Hypoglycemia. Correct answer, B. Dehydration. Question 44. Which is a normal finding in a newborn? A. Irregular breathing. B. Grunting. C. Retractions. D. Nasal flaring. Correct answer, A. Irregular breathing. Question 45. A newborn's first stool is called A. Transitional stool. B. Meconium. C. Loose stool. D. Watery stool. Correct answer, B. Meconium. Question 46. Which newborn requires immediate attention? A. Heart rate 130 bpm. B. Respiratory rate 40 per minute. C. Central cyanosis. D. Temperature 36.8 degrees Celsius. Correct answer, C. Central cyanosis. Question 47. A newborn should be bathed. A. Immediately after birth. B. After temperature stabilizes. C. Within 10 minutes. D. Before feeding. Correct answer, B. After temperature stabilizes. Question 48. Which is the priority newborn assessment? A. Head circumference. B. Airway. C. Weight. D. Length. Correct answer, B. Airway. Question 49. A newborn's lanugo is A. Infection. B. Fine body hair. C. Skin rash. D. Allergy. Correct answer, B. Fine body hair. Question 50. A newborn's vernix caseosa is A. Infection. B. Protective white coating. C. Rash. D. Bruise. Correct answer, B. Protective white coating. Question 51. Which is normal newborn breathing pattern? A. Apnea for 20 seconds. B. Periodic breathing. C. Continuous grunting. D. Retractions. Correct answer, B. Periodic breathing. Question 52. A newborn's umbilical cord should fall off in A. 1 to 2 days. B. 3 to 5 days. C. 1 to 2 weeks. D. 1 month. Correct answer, C. 1 to 2 weeks. Question 53. A newborn with jitteriness should be assessed for A. Hypoglycemia. B. Fever. C. Infection. D. Dehydration. Correct answer, A. Hypoglycemia. Question 54. Which reflex disappears first? A. Babinski. B. Moro. C. Rooting. D. Grasp. Correct answer, B. Moro. Question 55. A newborn's normal oxygen saturation is A. 70%. B. 80%. C. 90% to 100%. D. 50%. Correct answer, C. 90% to 100%. Question 56. A newborn should feed every A. 1 hour. B. 2 to 3 hours. C. 6 hours. D. 8 hours. Correct answer, B. 2 to 3 hours. Question 57. Which finding indicates hypothermia? A. Warm skin. B. Lethargy. C. Active crying. D. Pink skin. Correct answer, B. Lethargy. Question 58. A newborn's head molding is A. Abnormal. B. Normal finding. C. Infection. D. Injury. Correct answer, B. Normal finding. Question 59. Which newborn needs immediate intervention? A. Acrocyanosis. B. Central cyanosis. C. Vernix. D. Lanugo. Correct answer, B. Central cyanosis. Question 60. A newborn's rooting reflex helps with A. Walking. B. Feeding. C. Breathing. D. Crying. Correct answer, B. Feeding. Question 61. Which is the normal newborn pulse? A. 60 to 80 bpm. B. 80 to 100 bpm. C. 110 to 160 bpm. D. 170 to 200 bpm. Correct answer, C. 110 to 160 bpm. Question 62. A newborn's transient tachypnea involves A. Slow breathing. B. Rapid breathing. C. No breathing. D. Labored breathing. Correct answer, B. Rapid breathing. Question 63. Which newborn sign indicates infection? A. Good feeding. B. Lethargy. C. Pink skin. D. Active movement. Correct answer, B. Lethargy. Question 64. A newborn should pass meconium within A. 6 hours. B. 12 hours. C. 24 to 48 hours. D. 72 hours. Correct answer, C. 24 to 48 hours. Question 65. A newborn soft spot is called A. Suture. B. Fontanelle. C. Molding. D. Skull gap. Correct answer, B. Fontanelle. Question 66. Which newborn reflex indicates startle response? A. Rooting. B. Moro. C. Babinski. D. Grasp. Correct answer, B. Moro. Question 67. A newborn with poor feeding should be assessed for A. Infection. B. Normal finding. C. Growth. D. Hydration only. Correct answer, A. Infection. Question 68. A newborn's normal skin color is A. Blue lips. B. Pink. C. Gray. D. Pale. Correct answer, B. Pink. Question 69. A newborn's chest movement should be A. Unequal. B. Symmetrical. C. Weak. D. Absent. Correct answer, B. Symmetrical. Question 70. Which newborn finding is most concerning? A. Acrocyanosis. B. Vernix. C. Grunting. D. Lanugo. Correct answer, C. Grunting.